Microsoft's CSR. Microsoft is an American multinational technology company with their headquarters in Redmond, Washington. Microsoft was the largest software and programming company worldwide by net sales from 2017 to 2019. In the latest year, Microsoft's sales revenue reached 118.2 billion US dollars. Everyone knows a little bit about Microsoft, and these are some of the perhaps lesser known things that Microsoft owns or are a part of. Skype, Nokia, LinkedIn. They have Xbox as well as the Surface Pros, the new touchscreen laptops, and then they're also part of the Bill and Melinda Gates Foundation. The Gates Foundation gives back through global health initiatives, education, helping and addressing poverty issues, and altogether, the Gates Foundation the Gates have put $28 billion toward the foundational causes, and in total have given $36 billion to charitable causes worldwide. Now, the social issue that I'm addressing with that the Gates Foundation has addressed in significance is malaria. Among many of the social issues that Microsoft has pledged to help, one that caught my attention was the effort made to global health, particularly towards the malaria virus. First, a little info on malaria. The virus malaria is caused by parasites transmitted by mosquitoes and affected 219 million and killed close to 500,000, or 90% in Africa and 60% in children under 5. In relatively mild cases, it can cause high fever, chills, flu-like symptoms, and severe anemia. And anemia, for those that don't know, is a condition where you lack enough healthy red blood cells to carry oxygen to your body's tissues. Having anemia can make you feel tired and weak and can cause severe vomiting. These symptoms can be dangerous for pregnant women and young children who are experiencing the disease for the first time. Now, the impact that the Gates Foundation has had on malaria has come in monetary, but the monetary effect of those things kind of trickles down as so. So, in the $2 billion that the Gates Foundation has dedicated to defeat malaria, their foundation has used that money to partner with engineering companies that develop medicine that'll kill male mosquitoes that transmit the malaria bug or malaria virus. And this is one of the many things that they've done recently to address malaria. Other ventures include advancing the malaria vaccine, new drugs to combat the virus, and innovative mosquito control with updating their nets to be pesticide resistant or have pesticide resistant particles in them and things of this nature. The Gates Foundation ultimately wants to eliminate malaria within a generation, tackling a disease that has recently been on a fatal rise after decades of decline. Now, some of the struggles that the Gates Foundation and other people have had in combating malaria is that malaria as a virus can mutate and change and becomes resistant to drugs and pesticides over time. Since 2000, the total number of malaria-related deaths has halved from about 840,000 in 2000 to about 440,000 in 2015. However, health experts have warned against complacency, despite the reduction in deaths from 2000 to 2015. Overall funding for malaria control has plateaued. The malaria parasite has also begun to develop resistance to current available drugs and insecticide resistance as well. Unfortunately, as the world grows complacent in the effort to stop malaria, the virus will not stop affecting countless lives and get out of hand. Now, some of the successes and accomplishments that the Gates Foundation has experienced. In 2000, it's estimated that about 1 million African children have been saved from malaria. New tools such as long-lasting insecticide-treated bed nets, like the ones mentioned previously, have made recent progress possible. A surge of financial and political commitments as well from academic countries, donor governments, non-governmental organizations, private companies, and individuals sparked a decade of scientific advancement and the development of life-saving tools that fight malaria. Along with this, the first interim results from phase 3 trial of the malaria vaccine, also known as RTS vaccine, were announced in early 2019. The statistics go as so. In among 5 to 17-month-old children, the vaccine prevented clinical malaria in 56% of trial participants over a period of 1 year. Ultimately, it prevented severe malaria in 47% of cases. Now, my recommendations for scaling and improving. Although the efforts of the Gates Foundation has made on malaria seems enormous and seems to be executed well, there are a few things that I saw that they can improve on, and I've focused on one for improving and one for scaling. Experts suggest that the next catastrophe that could largely affect countries fighting against malaria is the medicine pesticide resistant strain spreading from one country to another. Perhaps having a more accessible educational source for those helping to fight the virus abroad would address issues like this that pop up as science and health experts realize the impact and concern that they have in regards to malaria. So if doctors are noticing this, in 2018, it took me a little bit of searching to realize that this was kind of an issue. Maybe if the Gates Foundation posted, recently discovered, things that maybe physicians should pass on to those working in their practice or patients that they see that have malaria. Maybe they can pass on this kind of information saying, be careful when you're traveling. If you're traveling and you have malaria, the malaria that you pass or that you bring into a country it could have a mutated or a resistance to the drugs and the vaccines that they're trying over there, therefore kind of defeating the efforts that they're making with their particular strain of malaria in a different country. So this might be something that could be on a site as information that physicians could have handy to give to other professionals or patients so they can be aware of how to best combat a virus that they have or their family members might have. Now, that was improving. As far as scaling something like malaria is difficult. Ultimately, scaling up solutions to malaria in order to fit the need of those being affected is difficult. I thought that maybe getting more people involved in helping fight malaria would help. Putting ads out to indicate how people could help and at a low cost at which they could do it could help. Maybe a small blurb that educated viewers and then something that followed up that indicated the price of perhaps a net, which is about $5 to $9, or the chemical treatment that would go on beds, which is about $1 to $2 a year. If an ad contained the education and maybe a link to a cost in which a person can help, this was an idea that I thought that would appeal to me as a college student, something small that I could at least contribute. That is, ultimately not affecting me that much, but affecting greatly the people that might receive that net or that bedding for that whole entire year that is resistant to resistance to mosquitoes. Now, these are my suggestions on improving and scaling. On a side note, I've been hearing about the effects of some of these major global epidemics for a while. If any of you are interested in learning more, please do. For others that are interested in contributing like I wanted to, I liked the nonprofit organization, the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Thanks for listening to my presentation, and here are some of my sources. Thank you very much.